Good evening, friends. I'm Commander Atul Kumar Rohatgi speaking to you on behalf of ISHRAE Institute of Excellence. Today, in the series of HVAC talks, this is a specific talk based on a request by one of our alumni who wanted to know about what are the requirements for NICU, that is Neonatal Intensive Care Unit HVAC design. This talk will be primarily about what all care that we need to exercise in the HVAC design of NICU. What is NICU? As I told you, NICU stands for Neonatal Intensive Care Unit. It's part of a hospital where babies or infants are kept just after their birth. And babies, when they come out of mother's womb, inside the mother's womb, they are at around 37 degrees centigrade. When they come out, they are then exposed to the atmosphere at whatever temperature that they are kept. So very often they are requiring to be warmed up. They have to be kept safe from infections. They have, for their comfort, temperature, humidity, and noise needs to be controlled. Whereas for safety, their safety from infections, we need to use filtered air and also keep the room at slightly positive pressure so that infections don't come in. The temperature is the basic variable in air conditioning that needs to be controlled. Approximately 22 degrees centigrade will keep them comfortable. However, they will at 22 degrees centigrade also they need to be kept in blankets so that they remain warm. Because as I told you that inside the womb that they are at 37 degrees centigrade and they should not get a shock, temperature shock when they come out. Some children may need to be kept in slightly warmer conditions in their incubators, particularly the premature children. They need to be kept in an incubator. In any HVAC job, temperature and humidity controls are the primary needs. And low humidity can cause cracking of the skin of infants. High humidity can cause infectious bacteria to grow, and therefore, unless it is otherwise specified, RH should be kept between 40% and 60%. In winter, it might be difficult to keep the RH at 40%, but care has to be taken that the RH is maintained at 40%, and for this purpose, water vapor could be injected. Dust control in an ICU. Presence of dust in breathing air can cause respiratory problems for infants. And dust level can be controlled by installing filters. What size of filters? What kind of filters? Well, for different needs, the requirement of filters could be different. However, a series of coarse filter, fine filter, and superfine filters up to MERV 14 is suggested for this purpose. Infection control in an ICU. How do we control the infections, spread of infections? We are injecting fresh air inside the NICU, but how do we ensure that only fresh air come in contact with the infants? And that can be done by controlling the pressurization in the compartment. Typically, an ICU should be kept at slight positive pressure so that the air movement is always taking place from positive to negative, and the unfiltered air from outside will not be able to come in that case in contact with the infants. Infection causing bacteria can be prevented by controlling the direction of air movement by creating positive and negative pressure zones. An ICU is recommended to be kept at 10 Pascal positive pressure, and this will ensure that the outdoor unfiltered air does not enter the NICU. Sound control is the next requirement. High air velocity in the room entrance can cause noise. Use of an appropriate diffuser at air entrance is what is suggested so that when the air comes in finally into the NICU, the velocity of air is less and so noise is not created. In case if a fan or a pump or any AHU is located too near the NICU, that can also lead to noise. And lack of proper installation of HVAC system or equipment can also cause noise. So we have to be careful about it. This noise will not let the baby sleep, infant sleep, and that will cause harm to their health. Redundancy in HVAC equipment in an ICU. Now, in a hospital, an ICU will also be an area which is critical. Air conditioning there is critical, and therefore we have to have redundancy. It is suggested that we keep an additional equipment for an ICU so that in case of breakdown or in case of maintenance, we don't have to shut down the NICU and we do not need to shift the infants at very short notice. Air ducts. This is also something that I need to talk to you all. The air, both supply and exhaust, should be routed through ducts. Very often in air conditioned spaces, we keep the return air, we allow the return air to travel through the spaces above the ceiling. And this, in the long run, there could be a lot of dust, there could be rodents there, and the air traveling through those spaces will turn out to be unhygienic. We should not allow that to happen, and the air inside a hospital must always travel through ducts. Understanding user requirement. I have talked about a lot of requirements that are normally understood and they should be followed inside a hospital. But how much? We must talk to the client and understand their needs, their specific needs, so that we could satisfy them best. Thank you very much for watching. My contact numbers, our contact numbers are given below. And as we have told you that we are from the ISHRAE Institute of Excellence, we conduct a number of professional courses in the field of HVAC and refrigeration for fresh engineers as well as for professionals who are already working in this industry. If you want to upgrade your knowledge, if you want to upgrade your skills, do contact us at the given below numbers and we will be there to help you. We are present on YouTube, we are present on LinkedIn and Facebook, and we have a website. Through all of them, you could contact me. And thank you to our alumni who had asked this question and given me an opportunity to talk about it. You could also raise specific questions through the comment box, and we will try to answer those questions. Thank you very much.